Kyle, we'll miss you. I have a sitter that I'm paying by the hour, though, so.
Thank you.
We love you. Thank you. All right, it is 6:36. Will the clerk call the roll?
Esri,
Here.
Michaels,
Present.
Rodriguez,
Here.
Sexton, Storr, Straub,
Yes.
Locke.
Present. All right. Would anybody like to move to approve the agenda? Ms. Straub, second, Mr. Esri. Any discussion? All right. All in favor, say aye. Aye. Any opposed? All right. Next up, we have approval of minutes. They were distributed via email. Did everybody have a chance to review them? All right. Do we have a motion? All right, Dr. Storr, and a second. Was that a second, Ms. Michaels?
Yes.
Okay. Thank you. Leading the witness. Any discussion of the minutes? Okay. All in favor?
Aye.
Okay. Any opposed? Okay, and that. Moving on. Is there any public participation? There is no public, so no public participation. Communications from the board? No? All right. We're just moving right along. I know. Amazing. By the hour. It's perfect. All right. Next up, our first item of new business is a mental health board opioid information. Can you please join us, Ms. Canfield?
Oh, nice. Well, thank you for having me.
Thank you for joining us. So the way we've worked our task force so far is we've invited stakeholders in to tell us their take on the state of opioid use and abuse within our county. And then we'll have some questions for you and ask for what your wish list item might be, you know, if we had a leprechaun. And we'll go from there. So the floor is yours.
Oh my goodness, I don't know that I'm so prepared. I've been trying to pay attention to what the state is doing with opioid settlement money, and I brought opioid settlement news in case y'all don't have it, but you probably do. And I think for the mental health board is not funding anything that is specific to opioids. Everything is, like, I'm sure you've heard this from people and you've probably said it yourselves, like, too bad it's not for all addictions, but here it is. It's an opportunity to address a really important one. So we have, you know, for whatever reason, like if you look by percentage of dollars the mental health board is spending on specific disability types, substance use disorder only is about 17%. But there are programs that are, especially those that are prevention and education oriented, that are mixed, substance use and behavioral health. So that's kind of nice that, you know, this is local money. We don't have to have the siloed approach that the state has. So that's an opportunity, but I would say maybe all of the programs that we fund are struggling still with workforce. So I think, I see like really great ideas that the state is talking about funding and NOFOs that are coming out, and they all require somebody to do the work, including this new focus on peer support, which is great. And I think we actually have some experience with peer support and professional peer support. And I think that, the word is out, maybe with not a great deal of sensitivity toward what that work really is and how traumatizing it can really be for the peers doing the work, and therefore clinical supervision has to look really different. So I think that the organizations that we fund that are larger and are certified may not totally have their arms around that, like how the culture has to change, how supervision has to change to really support certified peer recovery specialists, and then the other type of peer recovery, to really grow in that direction, which is a promising direction. And then I think the Mental Health Board has long funded small organizations that are peer run, and they have a whole different type of problem. Maybe they're a little more effective and can monitor themselves for post-crisis needs, but, they also try to stretch in every direction, and that's another hard thing. So none of that is specific to opioid use disorder, but a lot of it can apply in that area. So I think the pieces are there, but I am very concerned about how do you build a workforce, especially if you don't understand what your most desired workforce really needs to do. So I met with some people last week from, it's someone from the city of Champaign who's also trying to figure out what to do with their opioid settlement money, and then someone from addiction recovery at Carl. And we were talking about a recovery-oriented system of care, which I'm not totally convinced that this is the way to do it. My understanding of recovery-oriented systems of care is that they work really well if they come from people in recovery, not top-down. And everyone in this discussion was top-down. It was someone from public health, and it was a great discussion. We have great ideas, but it's not going to happen if the recovery community here isn't calling for it. So I don't really have advice for you, but my wish list would be that we could somehow put the recovery community, which is really diverse, in a position to direct services and funding a little bit. And the recovery community is so diverse that, some parts of the recovery community are responsible for a lot of harm. So anyway.
So I guess we all have different backgrounds here, so I'm going to ask you just to kind of maybe over-explain a couple of things here. So peer support is roughly just like a former user is now like your coach, like a sponsor in AA or something, correct?
That's one way to do it, yeah.
Okay,
there are certification programs now which help to, I have not heard great reviews of Illinois certification programs, but there are other certification programs for peers to learn how to do that professionally, support others, but you got it, yeah.
Okay. And you had said that the clinical support needs to look different. Is that because the peer-to-peer work can be triggering for both peers? Okay. And then I guess, does anybody have any questions? Ms. Michaels?
I have a question here, and I may be jumping out of sync a little bit. I'm talking about workforce, because you mentioned workforce a couple times. Are we talking about workforce while they are in a program, or workforce when they get out of the program, or both? And what do you see maybe some of our options with that, since you probably have more of a touch on it than we do? Well, I think you do.
This is a really huge pervasive issue. I'm going to be at national conferences in a couple weeks, and I will, go to, especially at NACO, I'll go to rooms where they're talking about what counties are doing with this, and then I can come back, or I could just send you notes from that. But your question about which workforce do I mean, that is actually a really good question, because it turns out that now it's all the workforces. So it is the, mental health professionals and substance use, I don't know, what are they called? CADCs? Certified addictions counselors, maybe? I don't know. All of these areas have been struggling to recruit and retain qualified staff. And for some reason, Champaign County has an especially hard time, and has, since before the pandemic, it's been more difficult to retain qualified professionals here. So I don't know if that's, sometimes I say maybe the answer is housing, but I'm not sure, because we are cranking out lots of highly qualified professionals right a few miles away, and to my knowledge, they don't stay here. And I've asked them, I asked student groups to help us understand why, and lots of things come back like, I can't afford a suit, I can't afford licensure and certification. So, these are like, maybe there's little opportunities. This is away from the opioid discussion, but so this is the workforce crisis that I've been looking at for a while, and no one's really been able to crack this. And it's even worse in the developmental disabilities care. But now we see a shortage of accountants, and that has affected our nonprofit organizations really pretty deeply. And what can I say that I talked to you about it, Michelle? Okay. A shortage of, or difficulty recruiting and retaining staff in county departments, especially lawyers. So, that all of that is impacting the ability to kind of like put this system in the right direction to provide the kind of care that's critically needed. So anyway, is that what you meant? Not really.
Any other questions? Dr. Story?
Thanks for coming, Lynn. I always enjoy hearing your perspective on some of this because you kind of reach out and seem to have a finger and tentacle in just about everything, and it's when you mentioned that some of these young professionals, graduates, are leaving because they can't afford the licensure and certification, that concerns me a lot, actually. We're facing that same problem in some other professions. What can we do to support those folks, and especially if we could kind of support them here?
Yeah, this is the trick with scholarship programs is you can't really bind people to work in the community after you've paid their way through school. In Michigan, they're advocating for a statewide program that would take bachelor's level social workers and pay them $30,000 a year to go back to school and become MSWs and LCSWs. So that's pretty great. Like if you've got a workforce shortage where you need LCSWs, then that sounds good. So pay them to go back to school. So we've been working on, I don't know if you all know this, but some legislators took a really strong interest in the Community Mental Health Act last year because new mental health boards being formed around the state were not being funded. They were being formed but not able to access any of the levy. So some legislators got involved and they've gone into all different areas, and it's, we had a lot of difficult discussions last year, and at the end of the year we got together with them, and one of the things that I asked them to put into the statute would be mental health boards can fund scholarships. That's been true forever and ever, but I asked them to put in language that we could also fund assistance with licensure and with professional licensure and certification and other educational opportunities. So it's like something like that, like allowing us to do it, then we would have to set aside money to do it. So there's much more to it than just opening the door. But I think programs like that are going to happen. I don't think any of us, any of the government units that we represent can afford to send people back to school for $30,000 a year, but if the state of Michigan figures out how to do that, maybe Illinois should take it up too. So anyway.
Ms. Straub?
Hi, Lynn. You spoke about hearing from the recovery community, the recoverment, about how to spend this money, and who would we contact?
That's what I need too. That is really what I need. You said leprechaun. I don't have good access to the diverse recovery community. I maybe have told you all this. I'm clean and sober for 36 and a half years, but it is, started with 12-step, and I even still have some of that strictness in my head, and I can see the harm that, myself and those who do it the same way I do can actually cause, especially to people with opioid use disorder. So not just that group. They're around and they might want to tell everybody what to do with their money or how to set. A recovery-oriented system of care is a great foundation for advising to like what kind of programs should be funded at an agency, and coordinating across all of the different systems, including the hospital, because hospitals are doing this work too. So, but I don't know that. I mean, I guess maybe I should just start going to meetings and trying to find people if I really want it that bad.
More meetings,
You know,
more
this is-
meetings.
yeah, but this is, you know, in Southern Illinois, there's a very successful recovery and a system of care that started that way, ground up. It's just everything went right for them because they started with the people most affected by it, not concerned citizens or concerned on their behalf or, you know, government. So I don't know, how do we do it?
Michelle?
I'd want to research it, but I think we could use some of the money to fund like a community-based survey to reach out to people to get this information. I think we would want to contract with like Cunningham Township or something like that, who already has the relationships and the people. But let me just triple check the spending restrictions. But I think that would fall under data collection, which we would be using obviously then to determine what we're going to do next. So.
Okay, it's just, I should never have a microphone and not a timer on. So you probably know that the Mental Health Board has, for over 20 years, the Mental Health Board has funded some services that serve the drug court. So that's, you know, that's an old collaboration. It's pretty solid, but it's not always working as well as everybody wants it to. So that, you know, the judge who used to run it would just come in the office and say, I don't like what's happening over at that agency, fix it. And we'd be like, okay, I don't know how we can fix it. But those were the good old days when they weren't having as much trouble staying fully staffed. So now, you know, for the last few years, we haven't even been able to collaborate as actively, but the problems associated with that agency not being fully staffed have gotten worse. And then it turns out now barriers to growing the drug court, including in this direction, include county departments not being well-staffed. That is to me, that is huge because the state had a no vote and the person who was organizing it told me Champaign County is in mind for this. And we didn't even apply for it. It's federal money. It would have been about $350,000 a year. We didn't apply for it because it could not be sustained. There was no money in it for the other units of government, which would need to be fully staffed in order for it to work. So that felt really bad to me because the thing I harp on with everyone is if there's other funding for the thing, get it there, not from the Mental Health Board. So I felt like, okay, I gotta stop ranting like that. Anyway, so maybe there's an opportunity there to fortify drug court by making sure that all of the partner county units have what they need. I don't know how you could do that, but and then you also have to keep it opioid focused, so it's not for alcoholics or people with a meth issue, and those maybe are bigger issues here. So, anyway.
Ms. Michaels?
I just had another question, Lynn. Of the activities that you have now or have had done, what now are you actively working with or had worked with that deal with opioids? Because I think you probably have a few avenues that you've been doing.
I'll probably miss one. I have my computer in case I think I've missed one, but there are a few projects that we've been funding the last few years. One is a portion of the recovery home at Rosecrans, and that's all substance use disorders. And then a very small project that only serves a few people each year. It's a house. The person who runs the house is a recovering heroin addict. He has all sorts of different treatment services he can refer people to. Some he's qualified to deliver, and then some other modalities like vitamins, and meditation. So that's an interesting project. It's very, very small. And then there's another sober home that's just coming to town, and we don't have an involvement with them. We're not funding them, but that's sort of in between those two. I can look. We were funding some prevention education for young people because you probably know that Champaign County has one of the lower participation rates in the Illinois Youth Survey. So we were funding an agency to have a person go out and help encourage participation in the survey. So, but we cut that. They still have state funding to do it. But.
All right. Seeing no other questions, I'm going to make just one request of you. If you have another half an hour to sit here with us, after we hear an update from staff, we're going to have sort of a roundtable discussion about what we as members see our next steps being. And I'd love your perspective if you could, during that time, just chime in and be like, no, that's a terrible idea. Or yes, nobody's doing it. Or whatever. If you have another half an hour to join us, that would be wonderful. Thank you. Are there any other questions? All right. Next up, updates from staff. Thank you.
I think I just have two things. You should have got the link to the dashboard in the last email. So if you have any edits or questions or something's not clear, please let me know. GIS is happy to adjust that. But it's pretty packed with information and is a bit overwhelming when you first open it up. And then I think I'll give you guys a couple more weeks. And then if I do hear from you or don't hear from you, I'm going to reach out to the other kind of governmental entities in the county to make sure they're aware of it and talk with them about their data collection so that we can continue to contribute data from all the police departments and make sure MetCAD is plugged into it and that kind of thing so that going forward it's hopefully really encompassing of everything that's happening accurately and not us trying to retrofit data. So and then the other thing was for the C-carts, so for the rural transportation, I'm still working on that piece. I'm trying to get Judge Dwyer and Shannon from probation to sit down with me and give me some very concrete, this is how many people we think we would need it. Here's generally, I'm going to guess most of them are in Rantoul, but I'm sure some aren't. Because the C-carts people just need a little bit more information from that perspective to figure out what this cost could possibly be. And I can't remember if last time we talked about this, if I mentioned, this is a matching grant that we could provide to C-carts. So whatever we provide as the county, which is what this is, I think actually the federal government will match dollar for dollar. So I think even if we have what starts off as a pretty small ridership, this seems like kind of a no-brainer that we would want to try it and put some effort into it and see how we could get it to work. At this point, they're talking about, basically just a door-to-door service. Someone would call and say, I need to go to the methadone clinic, I need to go to my doctor, pick me up, here's what time, that kind of thing. So, of course, if we get more ridership, it might not be as tailored, but that's not a bad thing necessarily. So hopefully I'll get that meeting done and also be able to follow up with the C-carts people. And by the next meeting for this committee, we'll be able to actually talk about some concrete numbers and potentially an amount we might want to consider putting towards that.
Ms. Michaels?
I've got a question. I had an RPC meeting the other day, and Rita was saying something about making sure that we had something done by the end of February, because I think there's a March meeting for monies, and making sure that we get a match already in there. I know I'm not speaking this clearly, but I think it's really important to talk to her, because I think that there's a time factor in us getting this match, and I don't want to miss it if it's possible.
Their fiscal cycle is really wonky, so their budget is done for March. So I think that's what she's referring to.
Right.
Yeah.
And then my next thing, and I'm thinking way off the charts, folks. This is brainstorming 101, if you will, or 098 for some of you. What if we bought a vehicle with this money? Now, I know that there is maintenance, there's insurance, upkeep, things of this nature. I know there's also time frames that have to be predetermined based on what is already committed by RPC to C-carts. Because I know in Rantoul, they have 2 different time commitments already, but maybe we had something in the middle of that, 10 to 2 or something, because a lot of people do not know that their meeting doesn't come up till 12 hours before or something of that nature. And I was wondering if that's a possibility. And then with some of these funds that we're going to be receiving for the next 10 years, if we give a nominal amount, 1,500, whatever, to kind of do some of that upkeep, because then it would actually be a MTD bus. So I'm way out of the box here, but just trying to find ways to get people to their appointments, and at the very least, maybe buy 50 10-punch passes for people and say, when you graduate from drug court, here's your pass to ride C-carts. And that's just kind of way out there.
Yeah, I think the pass thing is a good idea, and for people who maybe don't qualify for C-carts and do need to even use maybe in-town MTD, should definitely talk about that, because I don't think we want to leave them out of the support equation. Right. From my conversation with Rita, my understanding was it's actually not a shortage of buses. And as Lynn alluded to earlier, it's a shortage of drivers. It's getting people to drive the bus. So we might want to have a conversation with MTD, who's the one who actually executes the program. If we're willing to pay a premium to make sure we have a consistent driver for our program, that's a conversation we're willing to have at least. But that was her concern was they've got buses, they've got brand new buses, MTD's got buses, they've got vans, they've got all kinds of things, but it's getting the drivers consistently has been the issue. So.
Other questions? All right. Well, I really strongly encourage everybody, if you haven't gone through the dashboard, to go through. I'm going to give you some highlights because I've spent hours just playing in this. In talking, we're all going based on anecdotal until we had this data. And in the 2015 to 2022 data that we have now, it's not just fentanyl that's gone up. Meth usage has, for opioid deaths and Narcan use, meth has gone up from 1 to 16. Cocaine has gone up from 7 to 19. The only opioid in which there is a decrease was heroin, went from 16 Narcan uses in 2015 down to 9 last year. And so it's not just fentanyl, that's hugely gone up though. I mean, there were 43 last year. It's hugely gone up, but it has, it's been across the board, not just fentanyl like we had been not led to believe, but we were all kind of leaning in towards, because that seems to be the narrative on a national level. Within the county, on a who's using, it's not children by and large. It's mostly adults ages 31 to 65. It's 2 to 1 men to women. If you really play with the dashboard, you can find that women are more likely to need Narcan on Fridays and Saturdays because that's when they're using, and men are kind of across the board. The only time that female outnumber male are in the under 18 population. In both the 12 and under and 13 to 18, there have been 3 girls and 2 boys in each of those age brackets. But that's a total of 10 under 18 since 2015 versus 377 above 18. So our talks ad nauseum about education we might want to reconsider where maybe we need to. Who's going to educate a 45-year-old man with like a DARE presentation? They're the DARE generation. They didn't listen. The dashboard also shows us all the fun places where people are using. I really encourage you to take a look at it. And then also who is using and who's having the deaths in the Narcan use within our county. It's mostly Champaign residents, but there's also from Coles County, Iroquois, Effingham, all over. So it's the numbers are fun. And I think we'll have a much better discussion of where we can use our funds and how best to use our funds when we all have a chance to really, really look at it, because the numbers are cool. sad, but cool. In terms of my question for you, Michelle, just some of our 2022 numbers aren't, do we know when they expect the 2022 numbers to be final?
22 or 23?
Well, it said, like, we don't have a number for like December of 2022.
Oh, okay. I'll follow
Yeah.
up with.
Yeah.
See about
There's, obviously, it'll update as it updates, but yeah.
Yeah.
Yeah, there's not numbers, individual numbers for 2023 at all on anything. I could, later, I'll show you
Okay.
where specifically, but yeah. But this is great. We were right that we needed the actual fact so we could make informed decisions. And if there's no other questions for staff or updates from staff, we can move along to our next step discussion. Ms. Michaels has already said her. Yeah, we've been talking about her outside the box thinking, and I think getting people to treatment is a great idea if we can do it. Dr. Storr, you always have lots of thoughts about what we should do moving forward, and I'm putting you on the spot. Do you have any thoughts?
Well, thank you, Chair Locke. It happens that I kind of underwent a tremendous memory loss over the holidays. And I had to kind of review some things in the pile of notes that I had to first find. I made a rash suggestion last year about what if we got some of the various entities together in one room. You know, nice breakfast, continental, of course, or lunch or something of that sort. Maybe even, why not a lunch? And encourage them to visit among themselves and perhaps see what sorts of collaborations they might come from this sort of conference. I know that I benefit from these sorts of things, and it struck me that this might be, and because I'm so dang lazy, having everybody else do the work seemed really attractive.
Yeah.
Can I, Lynn, like I know there's like the homeless council and there's like the reentry council. Is there a countywide joint effort around addiction or addiction treatment that already exists?
I don't think so, and I think that would be great. I don't need to get this close, do I? That's really weird. Sorry. That would be amazing. I mean, a lot of people are tired of always being together, but I think the magic is when they're like in the parking lot on the way in and out. That's when the real collaboration starts. So.
Well, I mean, I think Dr. Storr has a very good point, is
Yeah.
we probably have a lot of entities operating independently in silos, and maybe one of the first things is we actually need to start talking about a coordinated effort, not just around opioid, but like just the concept of addiction in Champaign County.
I think that is one of the things you do with a recovery and its system of care, and Carl is applying for a state grant to launch one. But, it'd probably be more effective if it were county. I don't know. Carl can probably bring people to the table like that, but we just want to make, I like that idea. I just want to make sure no one gets missed.
Ms. Michaels?
Real quick, I think I got the most information when Carl made the presentation as a side note to one of the one of the other boards, Board of Health. Got the most information from them. I may be speaking out of turn, but I do speak my mind here and there. I want to know where Rosecrans is. We spend a lot of money with Rosecrans. To me, back in the day, and I've been on this board probably longer than most of the rest of you here, except for Aaron here, I kind of thought that would be the group that would take the lead, that would do what we used to have on the fifth floor of Mercy or whatever it was, have some kind of mental health opportunities through them. And I really haven't seen that. Now, I know they're busy. I'm not saying they're not. But to me, with the funds that we spend, I really thought we would have more out of them. And maybe it's more of a statement than a question.
I'll step in and say, we didn't invite them. We haven't invited them so far, but we should have them here next time, and that is on my list. But yeah, they absolutely should be here. And that could help. Other thoughts? Oh.
Well, and just
Michelle?
to Lynn's point, you know, if this task force did decide they wanted to kind of be the foundation of a countywide council on this issue, you would have the ability to really ensure that, as Lynn was talking about, the recovery community is at the table as like a very significant part of the council itself, and not just the service providers who are doing what they think is right and with the right intention, but maybe not necessarily hitting the mark that we needed to.
Jen?
I think creating a council like that could potentially alleviate kind of a lot of the gaps that we're seeing in services. You know, for example, when Sheriff Herman and Captain Bogus were here speaking about, you know, what's happening in the jail and the potential for medicated assisted recovery, but then not having a clear path to treatment that they could release folks to, you know, maybe that could be alleviated in the council that Chris suggested. When we talk about trying to figure out what would be the best way to fund transportation to get people to methadone, to get people to, you know, treatment centers, to get people to detox when they say they're ready, which, you know, Kyle and I know that when people show up on our doorstep at work and say, I'm ready to go to treatment, boy, we better have somebody there to take them to treatment within an hour because, you know, that's a hard hour for them. So I mean, maybe that is the best, clearest answer, and it gets us closer to speaking to the people who are in the recovery community.
Oh, I hope it would get us forward. Yeah, Ms. Emily.
I think overall, reaching out to recovery alliances is a good first step. I know Chicago has a strong one. I've talked to a few people I had a phone conversation. This was like, I think years ago. But they didn't have any direct like points of contact for me, but they said working around community hubs. So for example, talking to people who do put on or who do run recovery housing, for example, and getting inside those conversations is a good next step. But I do think recovery alliances in general is a good place to start.
What I don't want to get lost in the discussion is what we've talked about before, where, you know, Judge Dyer comes here from drug court and says that his wish list item would be if we had more ability for medically assisted treatment. And that was to hear from the person in charge that drug court could use that the community could use that. I don't want us to get into, let's have a council, and we know that people can't get to treatment in Rantoul, and we know that people can't get the effective treatment in jail other than just drying out. I want us to keep all of these things at the forefront to the best of our ability during that time. And so, I guess I do have a question. Has our grant writer had a chance to look into the grant that Dave King from Carl had informed us about medically assisted treatment within the jail?
That's a good question. I'm gonna have to go back to my notes and see if I wrote down the name of that grant. But also, I know Lynn wants to say something, but just kind of piggybacking on what Diane said about holding their feet to the fire. And what you're saying, I mean, I think a council can do that, right? If you get everyone in a room and the consensus is, we don't have enough medically assisted withdrawal facilities, who has the capacity to do that? Okay, we'll go do it, right? Like it becomes like a unified request as opposed to maybe entities kind of sliding under the radar because no one's really holding them accountable for what they need to be providing to the county.
Ed, are you thinking, or was that her hand raising? I couldn't, okay. All right, sorry. So, oh, yes, Lynn.
It's encouraging that there are organizations that we could communicate with, and maybe they would also help with this one little thing that I've noticed, and that is when you really need the authentic information from people with lived experience or peers, that doesn't always, it's not always reflected in the way people behave at the council, right? I was at an opioid conference it was the large opioid conference that they do every year. This year it was in town. I think next year it's going to be a little too far for me to go to, but after one of the really inspiring presentations, a person stood up and said, "My name is such and such, and I'm an addict." And before he could say what he wanted to say, a professional stood up and said, "Don't use that word. That's internalized oppression." Like she might be right, but he was trying to say something. And it probably is, he was probably the most special guest in the room, the person we most needed to hear from, and he just sat down. So I think we all, we in the mixed group, even if like you're in recovery and a professional, have to really watch the behavior that makes people not come back, because then it is another pointless counsel.
So getting a feel for the group, would we want Michelle to triple check if we can use money to collect the data that she, I'm seeing some heads nodding. And how much it'll cost. And how much it will cost, obviously. But we would be interested in you following up on that. Is there support for a breakfast or luncheon for the extended community as suggested by Dr. Storr, or do we, any thoughts?
I think that's smart, and I also think there has to be some kind of agenda and
Yeah.
someone to then facilitate that agenda.
Yeah.
Yes.
Yes.
Like, don't just come and eat our muffins.
Yeah. Yeah, I guess that's,
I was thinking of sort of kind of an expanded panel discussion, sort of fill this place up with folks, let them run around, but also have a panel discussion. And I think that might be where kind of Michelle, that could kind of develop into what Michelle was wanting with or this is what I'm hoping for.
Ms. Michaels?
I just don't want it to be a sales pitch. I want it to be something honest and something that, once again, like Jen Straub said, is we have to have an agenda. We need to stick to our agenda. We need to have everybody know that this is what we're wanting to accomplish. So as a group, we need to say, what are we wanting to accomplish? And that's what we want to hone these people into, is what we're trying to accomplish. I don't want, and I appreciate everybody coming to the table because I think that's a great idea, Chris. I really do. But I think also there is a certain guidance to try to say, what can you do for this? Not what do you want from us?
So what do we want to guide them? Jen?
I guess I want to know where different agencies and entities, where they have capacity and where they lack capacity. I want, you know what I mean? Like, I want to understand, are the 2 methadone clinics in town, are they at capacity? Can they serve more people? Are we missing out on opportunities that the C carts could then, get them what they needed? We don't know, Is Rosecrans in any way, are they doing more than we know, or could they do more than we know? All of those things, I still think we've been talking to a lot of great experts. I've learned a lot. And I still don't think we have a picture of what the resources in this community are, so that we completely understand. And I know, this is a relatively small amount of money, right? Like, we're not going to fix this problem. But, like, I still don't completely understand what the biggest gaps are that we need to fill.
So for another meeting, we absolutely need to hear from Rosecrans to see what they're doing, or do we just want to invite them to a luncheon to see what they're doing with it? Yeah, I'd see Dr. Storr nodding. Yes.
I'd like to, I bet that they're probably wondering, why haven't we been invited? And maybe ask them what the put the question, maybe Lynn will kind of make a suggestion before we leave on what we should kind of focus on that council. I like your council idea.
Emily?
On the question about a luncheon or a meeting, I want them here. I think feet to
too.
the fire, like Diane is saying. Maybe a luncheon some other time, but like, we need some direct answers, and we need it to be accessible to the public.
Agreed. All right. Any other points anyone would like to make before we get to our last part about our date of our next meeting? All right, so at our next meeting, among other things, we'll be talking to Rosecrans. Not knowing anyone's availability, because we didn't pass the sheet around, we'll probably reach out and find out when Rosecrans is available, and probably keep the meeting generally around when we've been doing them, the first Monday of the month. I know Ed's never available on Thursdays and Fridays, as we talked. Yeah. All right, great. Well, we'll loosely find out when Rosecrans is available, when this room is available, and reach out to people probably on a Monday or a Wednesday is my guess, as they've always been that way. There is no chair's report, and at 7:23, we are calling this meeting adjourned.